Guys, I'm Kelly with Mid-Peninsula Moms Blog, and I'm so excited to be here with our beauty expert and contributing writer, Dr. Jayaram. And today we're talking about BOTOX. Everyone is super excited for this Facebook Live. I was getting so many emails, and people were hashtagging asking for a friend.
It is funny that I love the hashtag
Yes.
asking for a friend, because quite honestly, this is probably one of the largest parts of my practice.
Yeah.
Something that is ubiquitous. Everyone's interested. Everyone wonders. Everyone has this question that they haven't gotten a chance to ask. So
Right.
Now's your chance.
Now's your chance. So we do have some questions here that I'm going to ask. We have some that were emailed in. And as always, ask your questions live. We also have a special treat. Our sales director, Erica, is here. She's sitting in the chair, and she's going to be getting BOTOX live after our little discussion. Okay, so let's get started.
All right.
The first question is pretty simple. What is BOTOX?
What is BOTOX? So great question, because I think the vast majority of people may not actually know.
Yeah,
the
what exactly is it? Yeah.
So BOTOX is a compound that's actually derived from a bacteria, Clostridium botulinum, and that it actually is found or extracted from the intestinal tracts of fish, shellfish, some mammals. That's where we get it from, and it is a toxin. So I think when I say that word, probably a lot of people are like, oh gosh, well, never mind, it's a toxin.
Right.
So let's talk about that. A lot of toxins are very concentration dependent. So in very high concentrations, BOTOX can be an actual threat. It can be fatal. It can have very significant side effects. Now, in the concentrations we're talking about in the vials of cosmetic BOTOX and the amounts that you're getting injected, I can't even stress to you how much of a order of magnitude less than being dangerous that is. It is a whole different thing.
Yes.
So it is a toxin from a bacteria. It is a compound that when we formulate it ourselves, will act on nerves and muscles to help decrease movement.
Okay. So it decreases
it.
that movement in that muscle.
Correct.
Okay, perfect. And what do you think? Well, that was actually my next question. What exactly does it do?
So why don't just to expand on it, for any science geeks out there, I'll go into a little bit more of detail on what it does.
I'm a little bit of a science geek.
We all are, and I think also understanding this on a science level in some way just kind of makes you feel a little more comfortable.
Makes you feel better what you're going to do.
Exactly. Yeah. So BOTOX, I think one thing that's really important to understand is it's locally active. It's going to act where you put it. So it's not something that necessarily runs around your body, right? We're putting it most commonly in the face, most commonly in the forehead, and it is acting where we inject it. And what it's doing is all movement is produced by a nerve sending a message to a muscle and the muscle moving. And BOTOX interrupts that message delivery.
Okay.
So in the most simple way I can explain it, it is something that is going to not allow that muscle to move, and we use the word paralyze. That word is scary, but it is causing a slight paralysis of the muscle, meaning the nerve can no longer cause that impulse to kind of cause that muscle to move. Okay. So, on a scientific level, that's what the toxin is doing.
Okay.
Okay.
And we're going to talk a little bit more about this later, but I'll just jump in since it's kind of relevant here. How long does that paralysis last?
Great question. I think there can be a bit of variability. So I'm going to give you these numbers, but just know that not everybody falls into the cookie cutter description of this. First, I'm going to tell you that BOTOX actually takes about 7 days to actually act. Okay. So from the day you get your injection, and when we show our lovely Facebook Live injection today, it's not like she is going to experience that effect immediately. Okay. So some people notice it as early as 3 to 5 days. Some people take as long as 10. The company likes to tell you 2 weeks and you get your effect, but quite honestly, right around that 1 week mark, most people have their effect. So it starts then, and then you have your effect most commonly for 3 to 4 months. Okay. I have people in my practice who I swear I see them back at 3 to 4 months, and it's as if it never wore off at all, and they actually last 6 to 7 months.
Wow.
Some, different people, their muscles act differently when treated with this. Okay. There are a certain number of unlucky souls who do wear off a bit quick. And so, maybe up to 2 months, and then they're starting to see that movement again. And unfortunately, that's, not something we can predict. There are a couple competitors of BOTOX that sometimes when someone's wearing off very early,
Mm-hmm.
I will try them just to see if they get a little bit of a different duration of action.
Interesting. Okay, perfect. What do you think is the best age to start Botox?
Such a tough question because
right? Everyone wants to know right now.
I guess the reason I find this tough is as someone who does a lot of Botox injections on people, my client ages range from 25 up until like 90.
Okay.
And so it's a big range.
Yeah.
Now to ask about when the best age to start is, I in particular am always hesitant to start anything on people very young. When my very, very young clients come into me, we have a great skincare consultation. And that's what I like to talk about. I like to talk about taking care of your skin.
We have a great Facebook Live on skincare.
Make sure to check that out.
We can link to that.
So, you know, the other side of that same coin is starting early is actually helpful in some ways. And I never want to be, you know, a plastic surgery public service announcement for 20-year-olds, but I will tell you there is a benefit in starting relatively early, because when you get to some of these lines before they've taken residence on your face, before they're there all the time, some of these treatments can be considered preventative, meaning you are holding off that wrinkle from living on your face by treating it. When you get to it closer to age 50 or 60, when that line might already, you know, sort of have a crease on your face, you can prevent it from getting deeper, but it's very hard to erase altogether.
To make it go away. Actually, that was one of the questions we had that was emailed in, whether this could be considered preventable.
Yeah. So some of the nerdy science behind that is that as we treat, and if we do stay on a bit of a 3-month regimen, I think you can make the analogy of putting an arm in a cast. You're not letting that arm move, right? So over time, that muscle might atrophy a little bit. And so it's just not as strong. So, you know, everyone always says, do I have to do this forever? Well, actually, in my practice, what I realize is, as you treat people who stay on a regular regimen, not only can we space their treatments out more, because you know that muscle is getting weaker, we can actually use less and less product as time goes on too.
Just because that muscle has just been weakened.
Getting a little weaker, just like that arm in a cast. So when you do Botox sporadically, so you do it and then, you know, you do it again a year later, or you do it again 2 years later, you have removed that cast when the Botox wears off, and so you don't get that same atrophy-like effect. So, you know, one of the more useful ways to do it, if you're going to decide to go down the road of Botox, is to start at a reasonably early age before, you know, you have deep lines and wrinkles, and try your best for at least a short period of time to stay on a little regimen. I think that's the best way to kind of get the most out of your Botox
So this is what I need to do, because I've actually done Botox, but I've been very sporadic. I did it once after my first baby, and then I did it once after my second, not right after. But yeah, I need to do it
a little bit more regularly, at least for a little period of time. And I think you will see a result.
Okay. What is the most common area that people receive Botox that you see?
So there are 3 FDA approved areas, and in my practice, all 3 are pretty equally done. In fact, the vast majority of my clients do get all 3 areas done.
Okay.
Because I don't have Botox on board currently, I'm going to show you these areas on my wrinkly face. So
I can do it too. I don't have any on board anymore.
So one of the areas is called the frontalis muscle, and that's going to be the horizontal lines across your forehead as you raise your brows. Another area is what we affectionately call the angry 11s, right? So that's going to be when you make an angry face and you get these vertical lines right here, and that area is called your glabellar complex, or your glabella. And so that's area number 2, and then area number 3 are the crow's feet. So
we had a question actually about this, the squinting around your eyes. So those are the crow's feet.
Crow's feet are really the horizontal lines you get when you smile that emanate from the corner of your eye called the lateral canthus. Now that will definitely end up getting ironed out when you treat. Now, the way she worded that question is interesting, because she said, will it stop the squinting? So it'll stop the line, but if you tend to be someone who smiles with your whole face and with your eyes, and your eyes, you know, do get a little bit smaller when you smile, it won't, you know, hold your eyes open. Now, I make that actually as a good point. It won't change the way you smile all that much. It will iron out the lines. So in general, that's actually favorable. That's what you would like to happen.
Yeah, you don't want to change too much.
Right, exactly.
You just want to look fresh.
Fresh and ironed.
Yeah.
And so what I would say is those are the 3 FDA approved areas. Now I make that distinction because I do, as an eyelid plastic surgeon, I do happen to do a few things just sort of off label that I think, conveys a good result, that, I have a lot of experience with and I feel comfortable with. So that being said, FDA approval means these areas have been tried, studied, evaluated, dosages have been determined. And so, for that, in those areas, we know a lot about it. In certain other areas that are off label, which we can touch on later, it's sort of an experience-based thing. If I'm an eyelid plastic surgeon. I know that neighborhood very well. And so I do feel like in my experience, I have enough data to kind of figure out what dosages and what's safe and what's not.
And what works.
Exactly. Yeah. So kind of you don't feel like you have to do the stencil of what's FDA approved. Talk to your plastic surgeon about it and see what they think they can do to give you a good result. Because there's some things that just take a long time to get the studies approved, or FDA, the FDA process doesn't mean you won't benefit from it.
Yeah. Just make sure you're going to someone who feels comfortable and knows what they're doing. And
Exactly.
Okay. Is Botox safe for everyone?
So in general, it is a very safe procedure. There is carries with it the caution that it can have an allergic reaction to it. I have to be honest, in my whole career of doing thousands of Botox injections, I haven't actually seen a full-on allergic reaction to Botox. I've seen injection site redness that does go away relatively quickly, but I don't classify that as a full-blown allergy.
Yeah.
However, there's a theoretical risk of an allergic reaction. And I think we're going to talk about this in a little bit, but it's not technically considered safe for people who are pregnant or breastfeeding. Yeah,
so that actually is the next question. So a woman that's pregnant should not get Botox, and what about nursing?
Great
and
questions.
How long do you wait before and after if you're planning? Or
Yeah, so this whole question can be answered by the really unsatisfying answer, we don't know. And the reason is because
which means no.
which does mean no. She's right. And so I'll go through that. So during pregnancy or nursing, it's not ethical to do the studies on those to see what Botox does in those situations.
Right.
So we do not have the data to know exactly what happens during pregnancy or, the exact type of birth defects that could potentially be caused. We don't know any of that stuff. By and large, if you understand the science of these things, you will realize that it is a locally acting substance. And so theoretically, it should not have any effect on pregnancy or breastfeeding.
Right.
That being said, I am a sucker for the rules, and I don't inject on people who are pregnant or breastfeeding.
Right.
But if if you're literal about it, it doesn't necessarily cross placental or blood-brain.
And if you had Botox and then you got pregnant a few months later,
So that does happen, because we don't always plan everything according to a perfect schedule. And so it often happens where, you just got your Botox injection and, you then conceive right after that. That is not something you have to be panicked about.
Right, exactly.
It is, again, I think that has happened many times, and we actually probably do have a bit of data about that because that does happen.
Yeah.
But we don't have the data about once we know somebody is pregnant and nursing, then what happens after they get injected.
So we have a couple questions here. Can Botox paralyze the muscles and cause permanent damage? That's the first question. She says she thinks her questions are getting answered, but let's ask that. Yeah. Can it cause permanent damage?
Okay.
To the muscle?
So Botox, by definition of being this bacterial found toxin, gets metabolized by your system. So it is not going to be something that sticks around forever. In fact, 3 to 4 months and it's
pretty much gone.
Pretty much completely gone. Yeah.
Okay. So even if you got Botox and you were unhappy with it,
it will wear off. It will wear off. Yep.
It's so fabulous. It will wear it will wear off, and your muscle will eventually go back to the way that it was.
That is correct. Although, one thing that I think is important to just make a quick differentiation between it. I think a lot of people use the terms Botox and fillers interchangeably, and they're not. And one of the, Botox is a toxin that's going to remember it prevents the nerve from telling the muscle move. Filler is a gel form hyaluronic acid based substance that's going to actually fill heal and improve collagen formation in a different area. It's a different thing. That's not a toxin.
Okay.
So essentially, the reason I'm making this differentiation here is because filler is immediately reversible. So let's say you get filled and you don't like a lump or a bump. There is an enzyme you can inject that reverses that.
Okay.
One thing that is important to know is if you don't like your Botox or if you have problems, it wears off in 3 months, but there is no antidote for Botox.
So you have it for 3 months.
You have it for 3 months. So,
okay.
One of the reasons people sort of often seek me out to do Botox is because one of the dreaded complications of Botox is eyelid droop.
Right.
And as an eyelid plastic surgeon, I take great precautions. In fact, we'll talk about that during our actual live demonstration on how to not get that and,
right.
And different things you can do around the eyes. But if you happen to get it somewhere and you do get a little bit of eyelid droop, unfortunately, you wait the 3 months until that wears off.
Until it goes away. Okay. Just checking here. Okay, perfect. Side effects. I know you talked about the potential for there being an allergy. Are there any other side effects?
Yeah, and these things are maybe you consider common sense, but I have to make clear that they are a side effect. You can get bruising. So as great of an injector as I think I am and all my colleagues are, it's possible that you do get a little bruise. The bruises tend to be light in nature. They can be covered up with makeup. They usually last about 5 days in general if you get it, but it's kind of binary. You either get it or you don't.
Yeah.
Oftentimes people come in here to get Botox on their lunch hour and they're going right back to work. 90% of the time, actually 95% of the time, can't tell anything was done to them,
Right.
But that is one of the potential side effects.
Okay.
And then we do consider eyelid droop a side effect, but really what that means is either too much concentration or incorrect placement of Botox was utilized. So that is one of the side effects.
But very easy to avoid if you.
I wouldn't say very easy to avoid. I do think it takes skill and good and anatomical understanding, but it is a preventable thing. Yes.
Right. Yeah.
And then, I always throw this in as a possible side effect is asymmetry. Now we hope that never happens, but one of the ways I always try to do very precise measurements and inject in correct places. But one of the ways I try to alleviate the anxiety for that is at 7 to 10 days in my practice, you are more than welcome to come in and if anything seems even slightly asymmetric, we fix it in a second.
Yeah.
And that's, complimentary from most providers, I think, but at least in my practice, that's how that works.
It's funny too, because there's a lot of asymmetry on your face anyway. And we don't even really realize it until we're looking so closely at it to see,
and
right?
Actually, Botox should be used to lessen your already existing asymmetry.
Right.
It's not algorithmic. Not everybody gets 12 units across their forehead.
Right.
Not everybody, it's the plastic surgeon looks at you, figures out where your slight asymmetries are, and then maybe even asymmetrically treats you such that those asymmetries get better. That should be the goal.
Right.
And we have little tricks, right? I know how to make the brow raise by 1 millimeter. I know how to make the brow drop by 1 millimeter. I can do all of these little things that will help lessen your already existing asymmetries.
Yeah. Okay. How long, so we already kind of talked about this, how long do you go in between treatments? So you really have to try it and see how fast your body metabolizes the product.
So I would say if you want to be a stickler for it and really get your best results for it, right about when you can start to see, not move, I like a little movement. I like brows to be able to move. But when you can start seeing lines being formed again, then it's time for you to repeat.
Okay. Now, this question's a hard one to answer because it kind of varies depending on where you go. But how much does Botox cost, just in general, so that our viewers can kind of see, does this cost $10,000? Does this cost $100? How much can you expect to spend?
Yeah, good question. So, ballparks are in the couple hundreds. And so, you shouldn't really be ever paying thousands of dollars for a Botox treatment.
Okay.
Unless, we'll talk about some exceptions to that, but those are more related to off-label areas that require a lot of product. But for the areas we talked about, in the hundreds range, and really anything that seems really, really cheap, and I would say like kind of less than a $200 treatment, something's up. I would question
where you're actually getting this.
I would question if it's real product. I would question, I would say something seems off because quite honestly, the vial for us physicians to buy is very expensive.
Right.
So it doesn't make sense
For them to charge you
very, very low amounts.
Okay.
Yes, that should raise a little bit of a red flag.
Okay.
Different people price differently. Plastic surgeons tend to price per, or physicians or dermatologists tend to price per area. That's a very common pricing module.
Okay.
And what that means is, we talked about the 3 areas. There's a fee for 1 area, there's a fee for 2 areas, there's a fee for 3 areas. What that does is that lets us treat to perfection. So that allows us to say, regardless of how many units, regardless if you need a little touch up at 10 days, you've gotten these areas, and my goal for you is to make these areas perfect. And that's the pricing module. A lot of med spas and other types of injection places like that will sometimes price per unit.
Yes, I've heard that before, where they figure out how many units they actually use on you, and that's the price.
Exactly. And so, if they undertreat you and something sounds like a great deal and you have to come back and get more, you're paying for more units. And so, I would say there's not a right way and a wrong way to price it, but as we all know, in every area, you get what you pay for.
Right.
And so if people, if you feel like a deal is a little too good to be true, it probably is. Yeah.
Okay.
You're either getting undertreated, or I'd be skeptical of the product, or, I don't know, I guess I would then, and I never like to speak ill of any injection person, but then I would wonder why they were underselling themselves. Because, it takes a lot of skill and artistic work and all of that to do. So the person has to value, their time and the product, right? So
exactly. So we had this question, how long until you see results? And we had said 7 to 10 days, up to 2 weeks.
The window is really anywhere from 3 days to 2 weeks. I have one client who swears that as soon as I inject her, she sees a result. That's highly unlikely, but yes, the usual is 7 days.
Okay, 7 days. Okay, perfect. So we do have some questions that were sent in. And then for those of you that are just joining, we're about to do a live injection on our sales director. She's sitting over here being very brave. So here are the questions. And some of this we kind of touched on. But does frequent exercise have an effect on how long Botox can last? And are there any tips to try to keep it to last as long as possible?
Do you want me to say never exercise ever?
Never exercise. You can stop. It'll last forever.
So because we now know that Botox is local and acts in the muscle that it is, injected into, I think we can kind of extrapolate from that it's unlikely that systemic exercise is going to make a huge difference on your duration, right? Because we're injecting it into like the forehead muscle. Right. So you going for a run isn't necessarily going to metabolize it all that much faster.
Okay.
There are some papers I've read that say that like frequent attempts to use that muscle will metabolize it a bit.
I don't have to be really.
Yeah. And also remember, you can't. So like you'd have to be sitting there trying to move like a lot. And I don't know how much I buy that, but I thought, worth letting you guys know.
Yeah.
So I don't think this is an excuse to not work out. I don't think those of us who work out are going to have less of a reaction or less of an effect of Botox.
Okay.
But just like with our meals, some of us are just really fast metabolizers.
Yeah.
And so if you're a fast metabolizer in general, you may locally metabolize that product
a little bit faster. And there's really nothing you can do about it.
Unfortunately not. No. Okay. And I wouldn't say, potato chip up on the couch for a week to make your Botox last longer.
Although doesn't that sound so fun? You must watch Bravo. Yeah. Okay. Is baby Botox a real thing? Not Botox on your child, but baby Botox. So getting a little bit of Botox in a specific place.
Yeah. So actually, this is one of the strategies I'll talk about when we do our live. I really believe in this, but different practitioners mean different things when they say baby Botox. So we should make sure we're on the same page. There can be what I call mini aliquots, so tinier little Botox sprinkles are often what people
I like
talk about.
That.
I know people love that because it sounds so pleasant,
cute.
Right?
Yeah.
So I do utilize a strategy like that on the forehead to ensure, one, an even spread, and two, that's one of the ways I'll talk about decreasing your risk of eyelid droop.
Okay.
So I do think that's a great one. And then one of the other things I mean when I say baby Botox is I actually, I do Botox in a very specific way. I have different dilutions of Botox for different areas on your face.
Okay.
And so the areas that I think, some people who already have heavy brows and already are worried about, a eyelid droop, and keep in mind, a lot of my patients are coming in for potential upper lid blepharoplasty. The last thing I want to do is drop their lids even more, right? So I will use not only smaller aliquots and maybe a few more pokes of just tiny little drops, but I'll actually use the more dilute solution on them.
Okay.
Versus I would never want to do that to the glabellar complex, because that's a really strong muscle. And so I use a more potent concentration there, because that's how you're going to get your result.
Okay.
So
there's a couple different ways people use that term, baby Botox, but it is a real term that people use. But maybe ask the question, if you hear, what do you mean by that?
Yeah, exactly. You should ask that about all things.
Yeah.
What do you mean by?
And I already asked this, but let's just talk about it again. If you start Botox young enough, can you actually prevent those deep wrinkles?
Yeah, I think, it's going to be really interesting to see, this generation that's commonly doing Botox as we get way older, and see if, elderly people actually look different in the future. But yes, even in a small study of just 3 years, you can start to see that you're really delaying wrinkles and you're preventing them from getting set in.
Okay. My last question, does waxing make your eyelids age faster from the pulling? Should I thread?
Okay, so great question. So I have so many thoughts on this question as an plastic surgeon. So anything that puts mechanical stress or stretch on your eyelids can make you move your blepharoplasty surgery date up.
Yeah.
That's the way I'll put it.
So it could.
Yeah. Repeat waxing, depending on the way your waxer does their procedure, can potentially, if you notice when you wax, there is a skin pulling effect, right? So that can, but let's take that question and extrapolate it to our day-to-day. Contact lens insertion can stretch your eyelids. Itching, if you have allergies and you constantly rub, that can make your eyelids age. So all of these things are things, so it's not just like waxing in particular, but that is one of the examples of the way that your eyelid skin can be stretched. Now on your eyebrow area where they wax is maybe a little better than actually stretching the skin on your eyelid, and they're not really waxing there, but that's something that's often stretched when we rub. So, public service announcement to stop
your
rubbing.
eyes. Yeah. Okay. All right. Perfect. Do we have any last questions live? We can keep asking them, I guess, but we're going to go ahead and switch. If you can bear with us for just a moment, I'm going to move the computer and we're going to get situated to do our live injection. And you'll get to meet Erica, our sales director. Okay. So this is Dr. Ann's office.
Welcome to my office.
And this is Erica, our sales director. She's fabulous and she's being so brave.
She is, and we thank her for getting her treatment live. Happy to.
How is this looking to you guys? I'm just adjusting a little bit here for you guys. That looks pretty good, right?
Yeah, I think it looks good. I think we can all see what we're doing here.
Okay, perfect. I'm just gonna hold it here. Do you need your light? Yeah.
I do. I'm gonna take
All right, she's gonna take that. It might get a little darker over here.
Okay, so what I'm gonna do very quickly before we inject is just do a quick Botox consultation, okay? So we can kind of get an idea of what things I'm looking for when you come into my office and what things you guys at home might be a candidate for. So every time someone comes in and we want to talk about the 3 FDA-approved areas for Botox, I ask them, go ahead and raise your brows for me. So she does have subtle lines across the brows, but not anything terrible, but ones that are a candidate for Botox treatment. Go ahead and make an angry face for me. She does have prominent angry 11s, so those are something, and she's young and beautiful, and so none of these lines are really there when she's not making those faces. So this is a great example of the right time to start and good option for prevention. And then smile really big for me. So these lateral lines out here are her crow's feet. So she's a candidate for all 3. I think today, just to kind of hammer home the friendly eyelid plastic surgeon strategy, I'm going to choose to treat her crow's feet today on live, and then she can stick around and get whatever she wants afterwards for being such a good sport. So a couple things I'm going to talk you through before I actually do the injections, just so you know. The skin should be cleansed before we do any kind of injection, and so I do always like people to try to come in without makeup on. Even if they do, I do a pretty thorough job of alcohol wiping
Can I come in a little closer for you?
Yeah,
Is that okay? We're getting requests to get a little closer.
Yeah, absolutely.
Show them all my wrinkles.
All right. So, and when we go, we'll try to do it in the light.
That's fine. Well, it's more important that you have light.
Yeah.
Yeah.
All right. So we've cleaned her now. The other thing, and then, I was talking before about how I tend to use different dilutions. So I have my different dilutions prepared. It's not just, one cookie cutter file for everybody. The crow's feet are stronger muscles, so I am going to use my slightly stronger or more potent formulation for that area for her. And, that'll be something she sort of gets a nice result with. I'm going to give you guys some behind the scenes information that I think not everybody knows to make sure is happening, but I think it's pretty important to see that people are kind of opening new things. I think it's important to see that people are drawing up with a different needle than they're injecting with. I know this is putting a lot of responsibility on you guys, but always good to just check. I like to do things very by the book, and it's never a bad thing when a patient asks, how are you going to do that? Or what is that? Or,
And make sure they clean your face.
I have a question.
Yeah.
If you are doing more than one area, do you use more than one needle? Or do you use one needle for the
I use one needle for the whole thing, unless you're using so much product that we have 2 syringes, and then there's 2 needles on there.
Okay. Does anyone have any questions before we start? Okay. My computer is actually really hot.
Oh, I'm sorry.
No, just crazy, man. Okay.
Right. So we've drawn up, and we like to make sure there's no little air bubbles in the syringe. That's one of the problems. And then the other thing that I think is worth asking, just from a pain and bruising standpoint, is the needle I use for injections is a 34 gauge needle. And I know that doesn't mean much to anyone, but it is literally the smallest needle that exists.
Okay.
Ophthalmologists often have access to these because they're teeny tiny.
Yeah.
And so I think that they can sometimes be a little bit less painful and produce a little bit less bruising in general.
Okay.
So I don't know if it's helpful for you to see, but if for any of those of you guys who are really needle scared, it's so
really
tiny. It's literally,
it
looks like a thread. So very, very small, and in general shouldn't be too painful.
I love her pink glove.
So you know what I like to call when you come into my office, I like to say that you get the pink glove treatment. And so that's my way of saying, you're going to be really well taken care of, but I also obviously like pink.
Yeah.
And if that wasn't enough, you're going to get a little pink ice pack. And one of my pain strategies is to actually hold the ice pack on the area we're going to be injecting. You can go ahead and hold it. And I always tell people do it until you have a little freezer burn kind of.
Okay. And that just will help with the little pinch that you'll feel.
Exactly, yeah.
Okay. How you doing, Erica?
Good. Ready for it?
Yeah.
So just to save her, we may just show you this one
Should
side,
the
and
other
then
side of-
we'll just do the one side
Yeah,
on the
well, that's
Facebook
good.
Live, and
Yeah.
then we'll kind of see. So I'll have you turn just a little bit just for camera purposes, and you'll smile really big for us. Good. She has this one prominent line. Go ahead and relax. Perfect. And she'll get a little poke here and a little injection, just like that. Perfect. And so I tend to do 2 of these. Smile again. I like to put them exactly into the crease. Relax. Perfect. And we can see a little wheel of fluid. I know it's tough to see on the Facebook Live.
I can maybe get a little bit closer when we're done here.
And what we can see, I think, actually is what she's left with. So so we've now put 8 units in these little crow's feet lines, and she's left with a very tiny little poke mark that'll be gone in about 5 minutes, and a little wheel of fluid. So that'll also be gone, before she gets back to work if she's doing a lunchtime BOTOX session.
Perfect.
So that's kind of it. Does anybody have any questions about?
Yeah. Does anybody have any questions live? Before we go? Well, thank you guys so much for doing this. Thank you. It wasn't bad, right?
No pain.
Yeah, perfect. And thank you for doing that live. That's extra fun.
Thank you guys for tuning in.
And we will go ahead and upload this. Sorry, I'm going to hold my computer. So we'll go ahead and upload this to YouTube, continue the conversation, and thank you guys for watching. We'll see you guys next time.